Good afternoon. This is Gus Bilirakis, and welcome to this episode of Discuss with Gus. We're doing it in the district this week. I really appreciate all your help and all your input, your letters, your emails, even if they're negative. Keep them coming because the more input we have, the better representative that I'll be. I also want to tell you that I want to express my condolences to the families of the victims in New York City, but all residents of New York and in the U.S. We are with you. We are New York strong. And this can't happen again. Ladies and gentlemen, we must get serious about these issues. If we're not safe, nothing else matters. National security should be number one as far as I'm concerned. In visa security, I've been working on these issues for a long time. And we must get it right. Some folks come in legally, for example, with a tourist visa, and they overstay. And then they get lost, and we can't track them. Now, this didn't happen in this particular instance. I believe this person was radicalized here in the United States. We've been talking about that issue when I was on the Homeland Security Committee. We must make it a priority to make our country safe. And you know, it's true. They don't all come from the southern border. We have people come in from the northern border as well. If they want to come here for the right reasons and they're properly vetted, of course, this is the United States of America, and we must welcome them. There's no question, but we must vet. For example, I have a particular piece of legislation to screen, have more visa security units in these high-risk areas around the world. We must get serious. We need more personal interviews and look into the individual's background to make sure that he or she is not coming here to do us harm. So it's a serious issue, and it should be a bipartisan issue. And I'm looking forward to looking into some of this legislation and passing it as soon as possible. Because as I said before, if we're not safe, nothing else matters. All right, well, I'm going to get into some of the letters today, and I want to answer your letters and tell you a little bit about what is going on or what has. Now, it's Friday afternoon, so I'm back from D.C., but what went on this week in Washington, D.C. on the floor of the House of Representatives. Okay, first we have a letter from Marilyn from Palm Harbor. Marilyn writes, as a psychiatrist in your district, I urge you to extend federal funding for the Children's Health Insurance Program, CHIP, as quickly as possible. As a matter of fact, Marilyn, we passed on the floor of the House of Representatives just this morning the reauthorization, a 5-year reauthorization of the CHIP program, okay? And we paid for it because we must pay for these things, and I think these offsets it was good public policy. I can get into the offsets if you'd like, and I will to a certain extent. Those that are making retirees that are making $40,000 a month will have to pay a little more for their Medicare premiums. Not much more, but a little more. So if you're making approximately $500,000 a year off of income, then you have to pay a little more for your Medicare recipients. Premiums. And that's not a bad thing. The lottery winners, if they happen to be on Medicaid, they should be taken off Medicaid. Why should we be paying for their health insurance if they won the lottery? Okay, those are two of the offsets, and I think that they're reasonable. You know, we have to compromise, and the money has to come from somewhere. So in any case, this program is helping many children, and it must continue. Maybe their families don't qualify for Medicaid. Okay, this is why we set up the CHIP program. But they can't purchase private health insurance. Well, they should have an opportunity to pay as much as they can afford to get their children health insurance. Now, I had a provision in this particular bill, actually a couple provisions, but I want to tell you about the buy-in program that takes place in Florida. But because of the ACA, we're now prohibited from using this program. So maybe a family that makes a little more money but has a hard time purchasing health insurance but does not qualify for CHIP. We're saying that they should buy into the program. So what it's costing the state, the family should pay, and therefore they cover their children, their children's health insurance, and the children can get the care that they need. And we're talking about at least, at the minimum, 12,000 children in the state of Florida. Okay, the CHIP program covers hundreds of thousands of children in the state of Florida. So it is vital, it's imperative that we reauthorize this particular program. In this particular bill as well that passed this morning, I was the main co-sponsor of reauthorizing the community health centers. So we put another $3.6 billion into the community health centers and reauthorize them for an additional 2 years. Again, we use this pay-for money to reauthorize these great programs that everyone agrees with. You know, community health centers are fantastic. We have so many in our district. If you're on Medicaid, you can go to the community health center. If you're on Medicare, you can go to the community health care center. If you want to pay privately, if you're insured, they take insurance. If you're underinsured, they welcome you. So in any case, it's a sliding scale, and the quality of care is terrific. We have them all over the 3 counties that I represent: Pasco, Pinellas, and Hillsborough County. So this is a wonderful bill. I also had an amendment in there to make sure that we take care of the U.S. Virgin Islands with regard to Medicaid, and this has to do with the storm issue. And of course, these are U.S. citizens, so we want to make sure that they're covered as well. Okay, let me go on to the next question. Because this has to get through the United States Senate, ladies and gentlemen. There's no excuse. This bill should pass. It's a great bill. I feel strongly about that. Okay, next we have Alyssa from Lutz. Alyssa says, as your constituent, I expect you to protect Medicare benefits I've earned. Medicare is a deal made long ago with all Americans that must not be broken. I'm concerned that some in Congress are considering drastic changes to Medicare, leaving the door open to a voucher system. Doing so would dramatically hike costs for seniors and pose serious risks to all hard-working Americans paying into Medicare today. We've worked hard for our benefits, and it's simply not right to cut them and take away what we've been promised and paid into over our lifetimes. Again, I'm asking you to keep Medicare's promise to the American people. And I agree with you 100%, Alyssa. You know, there's a lot of politics going around. There's a lot of rhetoric. And let me tell you, every member of Congress that I know of, on both sides of the aisle, wants to preserve Medicare, okay? And we don't feel it should be changed for current retirees or those close to retirement. However, what we need to do is preserve this wonderful program, one of the greatest programs in the history of the United States. We must preserve it for future retirees, okay? And I agree that we should do this in a bipartisan fashion, okay? So I'm for a commission made up